I'm delighted, absolutely delighted, to welcome our panel for this afternoon, each representing the 4 sectors we've been focusing on today, and they are care, health, education, and justice, as you know. So, I'm going to bring out our guests right now, so I would like to hear some rapturous rounds of applause, first of all, for Fiona Duncan, who's chair of the Independent Care Review. Hello, Fiona, you're here. Keep that applause going for Sir Harry Burns, Professor of Global Public Health at Strathclyde University. Nicky Murray, head teacher of Burnside Primary School in Carnoustie in Angus. And finally, Karyn McCluskey, the Chief Executive of Community Justice Scotland. Wow, what a welcome. They don't get that on question time, do they? Thank you for joining us this afternoon. We hopefully will be taking questions from members of the audience. So I'd like to think that those microphones are still out and about in the auditorium. You've been with us all day, and thank you very much indeed for that. In terms of care, health, education and justice, what's working well in Scotland in each of those sectors? Fiona, if I could come to you first in terms of care, what's working well for us in Scotland?
Okay, thank you. So I think probably what's working well is really illustrated by today. There are people all over Scotland who are absolutely determined to do the very best for children and young people and babies and infants who find themselves in the care of the state. They get out of their bed determined to love and respect and uphold the rights of children and young people, and they dedicate their lives to it.
Okay, can I just stop there? Are we okay? Can you hear the answers all right at the moment? Or is this... No? Okay. Well, can I just check with Harry? I'll come back to you in a moment, Fiona. Harry, in terms of health?
Yeah. Can you hear me okay? Yeah? So what I think health is doing particularly well is it's got a method for change. I think health is a very broad theme, health being a state of complete physical, mental and social well-being, not merely the absence of illness or injury. So it's not just about illness. We need to broaden our view of health and how we can help in this regard. But in 2007, we started a major change programme, which resulted in Scotland now having 36% fewer deaths after surgery since 2007. No other country in the world has done that. We've shown that the frontline staff can come together and make change happen. We then started to do that with our early years collaborative, and we've reduced stillbirth rate and infant mortality. And the ambition is to continue that into improving some of the outcomes that we've been hearing about today. So I think better than any other country that I know of, Scotland, the health system in Scotland is able to make change happen. The question is, how best do we then begin to use the insights we've gathered today and in subsequent meetings and so on to change the whole landscape around well-being in early life.
Okay. And Nicky, if we can come to you in terms of education, how is education doing in Scotland? Are we punching above our weight, or is there a wee way to go yet?
I think there's definitely progress being made. Within my own sector, there is a real focus on the biology of behaviour, and a number of schools are creating templates for others to follow. Gabor talked about whether or not people were invested in terms of neuroscience within schools, but there's a huge number of schools now who are beginning to hold professional learning opportunities that are re-engaging staff and adults in the schools and the wider community around the biology of behaviour. So that's certainly a change within the last few years. There is a certain drive in terms of understanding that there is a willingness to prioritise learning but also prioritise well-being, and that's certainly something that is being driven forward in most schools at the moment.
Prioritising well-being, you say?
Yeah. And also about generating well-being for themselves and others. So as Gabor talked about in terms of agency and learner agency, that's really at the core business of every school at the moment.
I appreciate these are very big questions for what I'm asking for very small answers, so I appreciate that. And Karyn, in terms of justice, how is Scotland doing?
Do you know, I think I might know half the audience. Do you know, there's so many things. I mean, it's really interesting. Paul Gray, who's the DG, he used to be the DG of Health, set up a Health and Justice Board because he absolutely saw the connection. And so we're connecting it up at a policy level, but the thing that I really like most is I know so many social workers and third sector in the audience who are absolutely saying to people who we connect with in the justice sector, what's happened to you? And I never saw that. That is a fundamental change, and it is a great question. And for all the people who are supporting those who are in addiction to change their lives, I mean, I see so much great grassroots work, and what I really like about it most is it's happening for the bottom up. And that's how I think change is happening. So, you know, for 1,800 people to turn out and to see the connection between early years and about supporting parents and kids and about what happens in the justice side is just huge. And it's taken us a bit of time, but it's changing.
And much more collaboration going on, do you think?
Oh, God, loads. I mean, we're not there yet. I mean, let's not hit the target and miss the point. I think our prisons still remain our worst public health problem that we have. We're warehousing the sick, you know. The level of physical and mental health that's in our prisons, you know, our prisons right now, that's not the fault of the prison service. They're just passive receivers of the injured, so traumatised. And we need to be able to have a philosophical thought experiment with ourselves about how do we change that, and to be quite bold going forward. Okay.
So we've talked about in each sector what's working well. What are the challenges, and what could we do better? Fiona.
Well, I think the first thing that we do, which we shouldn't do, is refer to the care system as a system, because Karyn's just said there are certain things we do well by joining up, but the fact is that any young person, child, baby or infant travelling through what we refer to as the care system may bounce into any one of 44 pieces of legislation, 19 pieces of secondary legislation or 3 international conventions. So we don't have a care system. We have a lot of custodians of parts of a system that collectively make up what we consider to be caring. But earlier when I was listening to Gabor speaking about attachment and about all the things that are associated around that, and really about time out and what time out is, it was making me think that at its very worst, Scotland's care system is us timing out our children and young people who have already they've already faced adverse childhood experiences, otherwise they wouldn't be in a situation where they need the care of the state. And yet what this state does is removes them from the families, possibly for good reasons, remove them from their brothers and sisters, almost certainly not for good reasons, and this is at its very worst. They often end up in new schools, trying to make new friends in a system that stigmatises them and discriminates against them. And then we wonder why we have intergenerational challenges about care. At its very worst, it's built into the system design a whole series of challenges which embed the conditions against stability and against relationships and against love and against nurturing.
So I'm hesitant to use the word system now.
Okay, good.
But
have other words I don't want you to use.
Are we getting there? So everything that you've encompassed in that answer, are we getting there? Is there still a long way to go with that?
So I was as surprised as anyone else was when I was asked to chair the care review, because I'm really conscious that chairs of reviews don't look like me. They look more like Harry than they do like me. Harry coughs every time I say something he doesn't want me to say out loud. But chairs of reviews do look like Sir Harry. They don't look like me. And we, through the process of the care review, have made sure that we're not reviewing the system. We're recognising the challenges that are within the system, but we're looking at what it feels like to be a child or a baby or an infant living in what we refer to as the care system. And so far we've spoken to over 3,000 people. More than half of them have been people with lived experience of the care system, and the other half have been paid and unpaid members of the workforce. And on Saturday I was in Inverness and I was talking to children and young people, and a boy said something, we were all asked the question about what superpower would we have, and a wee boy said that his superpower would be to turn into a stuffed animal. And I thought he meant like, one of those bears when you go into the Natural History Museum, but he meant a teddy bear or a cuddly animal, a stuffed toy, and that way he would get cuddles. Because people forget to hug him. Where he's living, people are working really hard to make sure that he's well fed and that he's done his homework and that he's tidied his room, but they've forgotten to hug this wee boy, and that's what he wanted his superpower to be. So, to answer your question, I think that I hope that the care review process will result in a review like no other, where it's been the experience have been in the system as opposed to the system that's been reviewed. But actually, that won't matter at all unless every single one of the recommendations that we came up with is implemented without fail. So the process is important, but the end result and then the implementation is as important. So I hope so.
Okay. Thank you, Fiona. Harry, challenges in the health system? I don't know, but in the health.
I'm going to slag off the system as well. So the late 80s, early 90s, I think it was maybe the end of Thatcher's era or Blair's era, or beginning of Blair's era, that saw the introduction into public service of this idea of new public management, which was all about targets and indicators and budgets and whatever you do, don't get the organisation into trouble. And I think that has kind of frozen our humanity a bit. The most important thing is to follow the protocol. I talk a lot to frontline staff about how they can change their interaction with citizens and so on. And they come back to me with what I've come to describe as the cold, dead eyes of the middle manager. You can't do that because I'll lose my job if you do that. And I try to encourage frontline staff to do what an individual needs to get them out of whatever hole they're in, regardless of whether or not they're allowed to do it. I look at the insanity of children being taken into secure care at a six-figure sum when they're maybe going into secure care because their parents maybe owe £1,000 worth of rent or something like that. Well, give them the £1,000 for God's sake. But yet our system doesn't allow that to happen. And that's true of the health system as well as any other system. So I think what I would want to see happen is us moving towards a system that is based on genuine care, respect, and empathy for people who are struggling. And part of what I've been trying to do in talking about ACES is to make people understand that people are struggling not because they are bad, not because they are incompetent, but because they have been in this position where they can't make decisions that other more affluent people would find easy to make. So we have to understand and we have to develop a way of working that empathises and helps them move through. And we'll get a chance to talk a bit more about that later, what that might look like.
Thank you, Harry. Nicky, same question to you. Challenges from your point of view in education in Scotland at the moment?
Yeah, I think one of the biggest challenges is leadership, and Sir Harry talked about decision making. And I suppose leading in a trauma-informed way is all about creating decision-making frameworks for the people that you're working alongside, and also supporting parents and children. An example would be simply safety, choice and trust, and what that might look like is if you need a wee bit of, a break, then you can take a little bit of time, or trust as in, I'm going to make myself available to you at some point during the day, and I absolutely make sure that I drop everything and make myself available. And choice is, what do you want your day to look like today? And it's as simple as creating that understanding that these concepts are unique and they recognise the individuality of every learner. And if you can empower staff with these decision-making frameworks, then all the schools in the country can continue the journey in terms of being trauma-informed. So decision-making and empowering staff with these simple decision-making frameworks like safety, choice and trust, or rupture, relate, repair, is so powerful but very important. So the challenge is leadership, I believe.
And when we've conducted interviews with people similar to yourself, head teachers, for the vodcast series leading up to the conference, there have been some real tangible results for schools that have taken on this way of nurturing and looking after their children. I'm sure you've seen exactly the same.
Well, yes, and schools are guided by policy, specifically Her Majesty's Inspectorate, how good is our school documents. Last week we were very fortunate to win the National Award for Health and Wellbeing, which in itself is a real sense of creating a template for other schools to follow, and it gives them permission to balance learning and well-being. So, yeah, I think there's certainly progress being made, and recognition that this is certainly the direction of travel and must be prioritised by every school in the country, I think is so important.
That's good. More power to your elbow.
Well,
and Karyn, in terms of justice, the challenges that we face.
It's not a system, is it? It's a series of processes that forgets the person, you know. And it's a really interesting thing. I know I've actually written help on my cup just in case I say anything really bad, and one of my team stands up and says, "Please don't say that." I spent time in Edinburgh Sheriff Court, and I just saw just a tragic group of people who had just been so abused and traumatised. And I tweeted afterwards, and it was all men, so I'm not picking on men for a change. You know, I'd said, I've just seen men with alcohol problems, men with drug problems, men who are homeless. They'd be better with a care package instead of the jail. And somebody had tweeted back, "That's enough about the sheriffs, what about the punters?" Which made me laugh. And actually, it came from a conversation that Harry and I had, because when you think about how expensive it is and what outcome that we want to reduce reoffending, we want to prevent. And until we start to think about it like that, we're just going to process people, and jail is going to become the absolute default. So we need to have a more in-depth conversation about what success looks like to us, and are we brave enough and bold enough to try something different. Somebody really clever said to me, the only reason we're still using the jails in Scotland is because the Victorians built them so well. And there is a bit of truth in that. We seem not to be able to change the system, even though we know the system isn't working for us. And don't get me wrong, I am no abolitionist. I've dealt with people who are really dangerous. And for the protection of lots of people, they need to be in jail. But I'm always saying you need to jail those who you're afraid of and not those who you're mad at. And we seem to be mad at an awful lot of people.
I think at the heart of everything we've been talking about today, and what we're talking about in the panel discussion, is we're talking about nurturing safe, kind relationships. To me, being a layman, a broadcaster, if you like, and new to ACES up to 2 years ago, when I first heard about it and it was explained to me, I was like, why doesn't everybody get this? I mean, everybody. I mean, that was from my point of view. Is it education? Does the media have a part to play? Or is there a lack of love? Is there a genuine lack of love? Fiona?
So I'm sort of basing some of the hope that I have for the care review on the Fibonacci formula. So if every one person leaves here today and tells one other person and convinces one other person that this was a good conversation to be part of and that there's another way of doing things, and then that one person tells somebody else, then I think that we will build a small army. And as Karyn says, it will be an army of the grassroots. I was thinking earlier when Suzanne was talking about tilling the soil, and I do feel that we have an opportunity in Scotland. Harry outlined some of the health figures where we have been an exemplar, and I personally think it would be negligent of us if we don't grasp this moment. I think Darren said that he wanted to take a moment to appreciate the magnitude of this time. I think we do have an opportunity because we have got multiple different sectors in this room today, and we do have people who recognise that there are things that are broken. There's a lot of good that we can build on, but there is a lot of things that are broken. We have a national performance framework that's got the word love in it, But I think that there will be a part for society to play, because if society doesn't buy into this, then I think our chances of having politicians buy into it are slim. And ultimately, we need the decision makers to be the brave and the bold people who will listen to others and make the changes that have to happen at legislation so that policy can change, so that practice can change. Because otherwise, the cold dead eyes of the middle management will always find a reason not to do something. So I think it takes all of us, and I think that if any of us think, oh, it's the media, or oh, it's the politicians, or oh, it's the grassroots, and we don't take our own personal responsibility, then my view is that we've been negligent.
Have we got in terms of policy making and contributing to policy making, Harry, I'll come to you for a second, have we got the right mix of people contributing to policy? So what I mean by that, are there enough people, for instance, that are care experienced, that are or should be contributing to the way that the country's going with this?
I don't think policy changes very much, if the truth be told. I think the success of the collaboratives that have changed patient safety and so on have come about because it was the frontline staff that made the change. We actually discouraged our politicians from going to those meetings at the beginning. You know, I remember having a conversation with one eminent politician and said, we'll tell you when we want you to come. And you get the frontline staff to design the change and to test it and so on, and then you've got a ready-made implementation. As someone once said, you can't expect frontline staff to be committed to any change they have had no say in shaping. And too often policy occurs because experts like me get in a room with ministers and we come up with a document that gets handed down to a civil servant, gets sent out, and folk look at it and say, what? You know? And so we are lucky in Scotland to have the insightful politicians that we've got, I mean, compared to what we might have. And they understand this way of working now. So I think what we should be aiming for is creating a narrative across all segments of society about the importance of support and care and love and compassion for families in difficulty, and what the implications of that will be in years to come. And to me, the one telling thing that will always get politicians interested is the fact that the ACES study, they calculated that 1 year's worth of child neglect in the United States brought with it a cost to the American economy, a lifetime cost of that cohort, that 1 year cohort, of $124 billion. Now, if that doesn't make politicians sit up, the Scottish equivalent of that's maybe £2 or £3 billion. Actually, it saves a hell of a lot of money, but it's just and fair and creates wonderful things as these children grow up to be creative and engaged.
I'm going to go to the audience in just a sec. Fiona, you want to come back on something?
I never thought I'd be sitting on a stage disagreeing with Harry Burns, but here goes. In terms of so I agree mostly with what you said, but actually in terms of the care review, I don't want the frontline staff to be the people that designs what good looks like, because I think there are many custodians of the system who have a vested interest in maintaining the system as it is. So in terms of the care review, it's children and young people and adults with care experience that are designing the future care. And, I'm almost finished disagreeing with you, Harry. And the other thing that I'm really keen on is I think that we do need, I agree that policy doesn't change things, but I think we do need an enabling policy environment, because right now there are so many different custodians of the system with their different bureaucracy and their different language and their different timeframes and their different rule books. That means that the journey, that the childhoods are lost within a system because some of the bureaucrats are holding the decisions that the children should be involved in, and we're losing childhoods. And the final thing is, I'm really excited about the prospect of doing a proper human and economic cost modelling again, words I never thought I'd say out loud, because I do believe that if we can understand truly the human cost of some of the decisions that we are taking, rather than the system cost, that we would do things differently.
Thank you. Nicky, Karyn, just very briefly, just coming up on that point in terms of the education sector and justice, frontline staff involved in decision making?
It's not just frontline staff involved, it's the people who receive our service who need to be involved. Because if you're not asking them what they want, then, I'm always saying that's the best question ever. What does success look like to you? And how can I help? So they need to be involved more. And sometimes, although some areas are absolutely fantastic at this, their voice is too seldom heard. And I think until we do that more, we're not going to be able to, we're not going to be able to make the progress that we want to.
Okay. Nicky?
I think absolutely Karyn's point about the importance of establishing guiding coalitions where you're taking on board every voice within the community to try and drive forward change, but every context is unique, and not only is it what success looks like, but what does it feel like, look like and sound like is so important whenever you're driving forward change. So I think, that's absolutely critical.
Okay. Harry, very briefly.
Just to come back to Fiona's point, the question you have to ask before you start any major change is, what do you want to change, by how much, by when, and by what method? I think we've got the method. We need to agree, frontline staff and citizens agreeing what they want. And for example, in the Early Years Collaborative, one of the things that was suggested as enhancing intellectual progress as well as attachment was bedtime stories. So that was something that was done between nursery nurses and frontline staff and so on. Of course you have to involve citizens, but you don't do it from the top down. When you want to make change happen, the people who have to make the change happen have to be involved with it.
Okay, good, thank you. Right, we're at 5 o'clock. Can I take where are our microphones, by the way? Microphones? There's a lady down here, the hand went straight up. This lady's bursting to ask a question. Okay, what is it to anybody in particular, madam?
Yeah, it's to Karyn. It was about, so you talked about the tragedy of people caught in the criminal justice system. The vast majority are collateral damage of the war on drugs, which is a war on people who use drugs, or in fact, as the Tories have just shown us, a war on poor people who take drugs. You talked about the bold and visionary decisions. Would you include a complete overhaul of our drug policy, including a debate on regulation being part of that?
Okay. A change in drugs policy, a change in drugs policy to end the war on drugs in Scotland. Is that what you said? Yeah.
So a change in drugs policy
to end the war of drugs in Scotland.
Listen, the war on drugs has failed years ago. It never worked in the States, it hasn't worked here. I mean, what a ridiculous concept. Do we need to change the policy? Yes, we do, and I think we need to include alcohol in that. We always seem to talk about drugs and we forget about alcohol. And I often talk about alcoholism, and always everybody. I'm not an expert enough in this. I'm really interested in it. Because people always talk about, would you legalise it? And I always say, well, we legalised alcohol and that's not done that. We've not been that great with that, because we drink to get drunk. So there's a bit that we just have to be really thoughtful about it, but we also need to look at some of the evidence. I quite liked Gabor saying that we need evidence-based politics, which would be really nice. At the moment, it's the sort of rhetoric that we get and who can be tougher on crime and tougher on drugs. And what we see is what I see in the courts, James Docherty always talks about that. You can't punish people out of addiction, and you just need to see all these women who are going to jail and lots of our young men who ended up in jail and dying of overdoses. It's no great, and it's getting worse instead of better. So we need to have a think of what other policy and practices out there and what evidence is out there to enable us to get better. I don't know whether that answers your question because I didn't hear it all, but...
Yeah, we are. There's just a slight bit of difficulty on the stage, so bear with us. But I hope that answers your question, madam. There is a lady at the back in a uniform there, Danny, just up the back. And if you could speak quite closely into the mic and nice and loud if you can, please. Off you go.
Hiya, I'm Gilly from the Scottish SPCA, the animal charity. We now take referrals for children who have harmed animals and work with them closely. Is the panel aware of the link between animal cruelty, human violence and the influence of ACES? And how can we get professionals in Scotland to recognise this link and actually do something about it?
Okay, so the question is from the SSPCA, and it is the link between animal cruelty and violence and ACES. And are you aware of the connection, and what can we do to highlight the fact? Yes. Okay. Fiona.
I'm just going to say, of course. I think, and particularly for those who are in policing and social work, etc., the link between animal abuse and domestic violence in particular has been well recognised. And so much so that we started to train vets many years, in fact, a long time ago, with Medics Against Violence about how to identify non-accidental injury in animals and then intervene with the person who was bringing it in, who was most often the woman and often sometimes victimised. But you're right, we probably need to do more. It was quite small work, and it should have been, I suppose, elevated. In terms of the ACES stuff, no, I haven't looked at that specifically, but I mean, I'm sure, the causal link, I'm sure is absolutely there.
Okay. Anybody else want to respond to that before we move on?
I think we're missing a big trick in terms of identifying where the issues are and delivering help to people. This morning I was at a conference from the Scottish Federation of Housing Associations, and asked them the question, if one of your housing officers goes into a house maybe twice in a month to fix a broken window, does that set alarm bells ringing? And they kind of looked round. And then I said, okay, if in that same house there's a woman who's on antidepressants, and if in that house there's a school child who's only attending school 50% of the time, put all of that together, is that beginning to tell you something? And that's the point. Google knows more about you than the people who can help you. Amazon can bring stuff to you without you asking, but yet we fail to understand that bringing all of this information together allows us to go and say to that family, look, what matters? How can we help you? What can we do that allows us to save things? And then ultimately one of the children is killed or something like that, and all hell breaks loose. Totally avoidable. So we can be using things and approaches and so on to help people. And I really mean that, help people. Ask them, what can we do that will turn your life around?
So, Harry, is it about looking for more clues then? Is that what you're suggesting?
Well, it's about using the information that we've already got in a much more creative and productive way, not to do things to people, but to support them take control of their own lives. And that's the critical bit in all of this. We can't bring that data together at all while we still have this public sector that wants to go in and punish people. We have to adopt an approach that says, how can we help?
Fiona.
My point builds on Harry's, really. I think that if we take situations like that in isolation, then we run the risk of demonising children because we've accused them of being cruel to animals, and actually that we don't take time to understand what happened to that child and why is that child doing what it's doing to that animal. So I worry about some of the conversations that we have in isolation, because I think that they stigmatise and do more harm to children and young people than do good. So I worry about things like that in isolation.
Okay. And finally, Nicky, on this?
Yeah, absolutely. In terms of gathering that information, which is so important, schools are developing strategies about folding the outside inside or into the centre, and that's about trying to give people, break down barriers, trying to give people what they want, what they need, starting food banks actually within the actual school premises themselves. But underpinning that, that's only, if you're supporting someone in terms of giving them what they need, it's really just the start of a conversation, and it's down to building relationships and trust, and that that only comes with really hard work and real determination to actually go into people's homes and really try and understand their needs. And I think that's definitely the work that certainly all the services in terms of children's services have to get better at talking with one another and sharing that information, because it's so important.
Okay, that's it for Nicky, thank you. I just remembered we had a question that had come in via Pigeon Post, I think. For the panel, please, what could be done in Scotland to utilise mindfulness to support our journey from ACES to ACES? Interesting question. Should we start with you, Harry?
Yeah. So I first learned about the neuroplasticity elements of ACES from a chap called Bruce McEwen, who's a professor of neuroscience in New York. And initially, this whole question of ACES, it seemed as if the brain changes were essentially set by about aged 8 to 10 or whatever. The brain was formed and therefore we couldn't do anything about it. It's now clear that that's not the case. Bruce McEwen has published papers that show in 35 to 55-year-olds using mindfulness and physical activity and creating a positive social environment changes the way your brain is structured. And there's a famous writer on mindfulness called John Kabat-Zinn who started using mindfulness in elderly cancer patients in their 70s and 80s, and began to show changes in behaviour and stress levels and so on. So the evidence is very clear about mindfulness. I've given a couple of talks to organisations that promote mindfulness in Scotland. It's a very active group of people. So it's already out there. Question is, we have to make it obvious that it is evidence-based. It's not some kind of new age thing or whatever. There is strong evidence that it changes things. And again, it's part of the narrative we have to create. We have to make people aware that this is a way in which they can positively influence their futures. Okay. So just keep talking about it.
Nicky, mindfulness to get us on this journey.
Yeah.
Do you use mindfulness in your school?
Yes, we do. People? We have sessions where families actually participate with the parents and the children, and also we have class-based sessions also. And as Sir Harry was talking about, it's really just bringing people's attention to it and hoping that they start to prioritise a little bit of time for it within their day and see it as something that's really valuable, and it's something that at the moment for us it's not as research informed in terms of the evidence base that Sir Harry's talking about, but certainly we're seeing benefits, and the families enjoy the time and the space to practice it, so it's impactful.
Mindfulness in the justice system, Karyn?
I'd really like it to be used by the staff. I think people are really stressed and really anxious. And how on earth can you empathise and form a relationship with somebody else if that big button is just on show because you've not dealt with your own anxiety and stress and trauma? And so I think getting us all to practice it, and myself included, I know you think I need it, I actually think is a first step, because I see some really stressed people out there who are dealing with massive workloads, with really complicated people who need better support. And I think we also need to look after ourselves. I don't know who it was said that if you don't practice compassion for yourself, how on earth can you do it for someone else? And so I think we need to start with ourselves as well.
Great, absolutely. And Fiona, mindfulness?
It's interesting because when you asked what was working, and I said it at the beginning, it's people. It's the people that I think are making a difference in children's lives. And Nicky's talked about what he does in his school, and I've been to visit children in their homes, and they have been surrounded by staff who are stressed, minimum contract, 0 hours, 0 contracts, living wage. And I do think that part of the structure of how we commission care and commission support exacerbates all of that. And I think mindfulness is really important. I thought Gabra's points earlier about empathetic witnesses and people feeling validated and worthwhile was also really important. And I guess I I agree with Harry this time, that there's something about, there needs to be a narrative, and we need to find what works for us, and mindfulness might not work for you, but something else might work for you, and I think we all have to find what's right, rather than going, this is the one thing, we've got a bit of science, we've got a bit of this, we're going to apply that universally, because it just won't work for everybody.
So it's about that, I suppose it's about that phrase that Nadine Burke-Harris used in September, about self-care. Yeah. In whatever guise that comes in. I want to take a question from up the top there. Yes, please. Nice and loud if you could, please.
Hello, my name's Brian Duncan. I work in alcohol and drug services in Aberdeenshire. And I'd like first to say how pleased I am to be in the same room and the same discussion as Gabor and Darren and Suzanne. It's been brilliant. My question is, to answer some of the contradictions, firstly, there's huge resources going into foster care, and there's more and more children going into foster care, but there's a group of people who carers who are terribly under-resourced, and that's kinship care. And I just wonder why that is. Secondly, in the criminal justice system, the drug-related deaths are still going up and up and up. And so while we're patting ourselves on the back for doing good, positive work, something's missing, that our drug-related deaths are still increasing. And lastly, in relation to alcohol, we have an industry in this country that's raised record profits for 18 years in a row. And I don't understand how we hold that up as a champion at the same time as we've got such a dangerous substance that we have kicking around. I'm not actually sure what the question is, but there are some big contradictions going around.
Okay, I think there's 3 in 1 there, so I'm going to split it up, and if we could be brief, because I'm conscious of time, we've got about another 10-15 minutes. Resources, money going into foster care, and is there a gap between the money that's going towards foster care and kinship care?
Okay, I'll be super brief. When I was appointed, I looked at the 6 reviews that had taken place between 2009 and today, and they'd all looked at parts of the system, and one of them had looked at foster care allowances. And I think that one of the things that I learned from reading those reviews and looking at all the serious case reviews and doing all of the desk-based stuff that you would expect me to do, is that if you lift one part out of a really complex system, move it over here, look at it, and compare it to another part, take it and drop it back into a complex system, the complex system will consume it. So what we haven't done is looked at the difference between the allowances for foster care or kinship cares. We are looking at that too, but that hasn't been our principal focus. What we've looked at is what is the best environment for a child or a young person, and how do we keep them safe, how do we ideally keep them going to their school, keep them with their brothers and sisters if all of those things work for them. So you're absolutely right, there is a difference in terms of the level of resourcing around that, but there's a whole bunch of other inherent challenges and differences within the care system, like the category looked after at home, which is simply a category and not a service, and how that's got the least spent on it and the worst outcomes. But again, we're not looking at just those component parts, we're looking at it in its entirety. So what you say is absolutely true, and we will come up with a response to that, but it will be based on what works for babies, infants, children and young people who need care.
Karyn, drug-related deaths in the criminal justice system, should we be patting ourselves on the back with one hand?
Oh, it's horrendous. I mean, I work with a lovely charity called the Simon Community, and they're constantly telling me about how many people are dying, through just expiring on their own, behind closed doors without anybody to love them, and, they don't care about living to next year, far less next week. And the fact that we otherise them and we don't talk about them, and Gabor says, why have we not got an outrage? He's right. The counter-terrorism thing is always, I didn't tweet that just in case I got some drive-by feedback from the security services. But it is a national outrage. And somebody had said to me the other day there, but they're all older. So, and your point is, caller, they say, but younger people are making better decisions. but they're our citizens as well, and we're still not dealing with it well. And there is something about someone leaving prison and may not have, well, probably have taken drugs inside the prison and gone out and overdosing, and that we know that evidence and we know who's most likely, and we just fail to intervene. And, and we're going to wrestle with this over the next year. When the figures come out, are the figures out yet for this year? No, I don't think they are. I think when the figures come out, we're going to have a really, difficult conversation with each other about what we're doing right and what more needs to be done.
Okay, thank you for that. Harry, the third part of the question was around the profits, alcohol, and once again, I think it was about being self-congratulatory in the country.
Well, interestingly, for most of the past 50 years, Scotland had one of the lowest death rates in Europe from alcoholic liver disease. And then about the mid-90s, it started to go up. And then by about 2005, we had the highest mortality from alcoholic liver disease in Western Europe. We compared them with 16 other Western European countries. We've come off the top now. We're a bit better than we were compared to other countries. And we were never, in the 50s, 60s and 70s, France had a huge mortality rate. We were never as high as that. So we shouldn't congratulate ourselves. There is no question that alcohol consumption, I think, across Western Europe is higher than it should be. But I think it's very difficult to come up with single short solutions. Minimum pricing will make a difference, a small difference, but it's a complex system that forces people to, or allows people to go and consume alcohol. And part of that is the fact that they just want to get drunk. As a surgeon, I would see patients coming in maybe the third or fourth time with a life-threatening condition because of their alcohol consumption. You'd say to them, you have to stop drinking, otherwise you'd die. And the response would be, I don't care. Life's crap, and booze is the only pleasure I've got. So we've got to get to that sociological set of drivers if we're really going to see things get back down to where we were 20, 30 years ago.
And is there a direct link to poverty in that situation?
Yes, there always has been, but it's certainly commoner the lower down the social scale you go.
I think I'm going to have to wrap up shortly. I think we've talked a lot about poverty today, but I think it's important, I would imagine, for us to all realise that ACES does not discriminate whether you're rich or poor. I think it would be fair to say. The
incidence is slightly higher at the lower end of the socioeconomic scale, but it's still very significant at the upper end.
Right, okay. You've been here all day, soaked in as much information as we all have. I've got two more questions for you. First of all, what are you going to professionally and personally take away from today? Have you had a standout moment from any of our contributors? So if I can start with you, Karyn, on that.
All right. Do you know, it's just been the opportunity to just sit and listen to Gabor. He's not flashy. He just sits and he had a narrative. And, just that opportunity to have a think about, put aside everything you think you know, and then start to think about a problem differently. And when he talked about addiction, that really came home to me about how else could we look at this? And it's really important that we do stuff here and now, but just because you put icing on a cow pat, it doesn't make it a cake. We might have to completely, change the way that we think about this. And that's going to be uncomfortable for people who are wedded to certain philosophies or, wedded to certain ways of doing things, because it will challenge them. Change is always difficult.
Fiona, a takeaway for you today?
So I've had an amazing day from the moment I arrived, actually, and every single thing that I've sat down there and listened to has been a privilege. And when I was terrified about the prospect of coming up here, I was trying to think of something clever and profound to say, and I struggled. But what really occurred to me was Suzanne was talking about tilling the soil and creating the right conditions. And I feel that in Scotland we have hope for something different, and that feels like the sort of fertiliser for that soil that has been tilled to create the ground. And then I was thinking about when Gabor was talking about the leaf that needed light and our connection with nature, and I think love's our light that we need to continue to shine on everything that we do to try and figure out how we can make life better for the children and young people that need us most.
Nicky, come to you next. Your takeaway from today, please.
Yeah, wow. I think I've taken about 16 pages of notes, which I'll digest over and over again. However, I think the most important part for me was when Gabor talked about two things children need, which are attachment and authenticity. And if schools can dedicate themselves to exploring both through educators becoming educated, that's something I will be really trying to drive forward, that message about attachment and being attachment informed, and also authenticity. I think it's so important.
Okay. And Harry?
Wow. Well, I've got a 1-year-old granddaughter, and some of his descriptions about the baby turning away in shame if you break eye contact and so on means I will absolutely maintain eye contact with her every time she's there. It's very easy because she's so beautiful and she just smiles all the time. She's so well attached. But I think what I take away is the absolute consistency of what we heard about the importance of this, the fundamental importance of supporting young people through those difficult times into an engaged adult life where they feel they can contribute, they feel a high sense of self-esteem and so on. And, you know, there are friends in the audience, I know, who have been through very difficult times who are absolutely doing that. It can be done. And what today does for me, it just redoubles my determination to make sure that we get to a far better place in Scotland. You know, we've done remarkable things with health care. We should be doing remarkable things with bringing young people to a full and productive life.
You've answered this, actually, in one way or another as we've gone through the hour. Time is nearly up. But for all of us in this room, the 2,000 of us that have been here today, one thing in your professional opinion that we can do immediately as soon as we step out the doors.
Oh, grief.
In a soundbite, as those
Can I use my
media
help
folks
cup?
would say.
Can you come back to me? Can you come back to me?
Okay.
I think for me personally, it would be about just maintaining that visibility, because being visible is sometimes exhausting, but it does provide opportunities for support and acknowledgement, which is so important to young children. So for me, it would be about taking these simple ways of working, and simplicity was called the highest form of sophistication, and it's true. But if you can narrow down to something simple, even just being there in terms of support and acknowledgement and checking in with children, just giving them space to share. So yeah, that's something I'll be taking away. You can try.
Harry, thank you.
Well, what I want to do isn't anything to do with my professional life, but when I get out of here, I'll walk down to Central Station and I'll pass 3 or 4 people begging in the street who are sleeping rough and so on. And every time I give people money, I want to stop and have a conversation with them. I want to ask them, why are you here? What matters to you? What could we do that would make a real difference? Rather than just give them money. And I think I'm maybe going to do that tonight.
And finally, Fiona.
I'm going to work hard to be as compassionate as I can possibly be.
This is what we can all do as well.
Yeah, and I would hope everyone else would too, and listen. So to Harry's point, you know, listen to somebody, give them an opportunity to tell you their story if that's what they want to do, and try and understand their perspective and what you can do to make their life easier or better.
Well, thank you ever so much. That was a quick 60 minutes. I hope you agree. Yes? Oh, I think we found it very enlightening, and it was very quick. I'm sure we could have taken a lot more questions. Thank you very much indeed to Fiona Duncan, Sir Harry Burns, Nicky Murray, and Karyn McCluskey. Thank you.